I'm Dr. Shirjil and you're watching my YouTube channel. If you like my videos, don't forget to subscribe. Now today in this phacoemulsification video, I will show you how to perform a vertical chop technique in NS3 cataract to perform in the bag phacoemulsification. In the bag phacoemulsification is a very cornea friendly technique, and people advocate that you should try maximum to perform the rexes behind the iris in the posterior chamber. So you can see that we are performing the routine phacoemulsification steps like main port incision with 2.75 knife, anterior capsule staining, side ports, and now capsulorhexis. Make sure you don't produce a very small capsulorhexis because vertical chop is difficult in small rhexis. And as here you can see we have formed adequate sized rhexis. The two most important steps are rate limiting steps are capsulorhexis and nucleus division in phacoemulsification. You can see the sweeping movement of the hydrodissection cannula. So we have performed hydrodissection as well. Now after deepening the anterior chamber with viscoelastic, I am putting the Ortli phaco probe, and you can see my direction is bevel down. I used to perform bevel down technique, as well as I use a dialer as a second instrument. So after aspiration of the superficial cortex, I made half thickness trench and then rotated the nucleus 180 degree and again made half thickness deep trench. Now I am holding the nucleus with the phaco probe deep buried into it at one end of the trench, slightly elevate it within the bag, and with dialer put the force in downward and opposite direction to the phaco probe to crack the nucleus. Now that is called vertical chopping. Now I slightly rotate the nucleus and again perform same maneuver to crack it. So in this way whole nucleus is divided into many pieces or cracked into many pieces. To learn this technique, you need to master the foot pedal control, because a slight upward or downward involuntary push of the foot pedal would leave the nucleus and make vertical chop ineffective. As you perform the whole phacoemulsification in posterior chamber and with a bevel down technique, the corneal endothelium is protected. The heat generated by phaco tip doesn't reach the cornea. You can see a cracked nucleus in the bag, and now slowly and gently we can aspirate it with the phaco probe. But in this technique you should make sure that your depth perception is good and view is crystal clear. You are 100% sure about your whereabouts, because you are performing phaco deep in the posterior chamber, and any inadvertent push can cause posterior capsular rupture. So PCR chances are more in vertical chop in the bag phaco as compared to the my routine tilt and chop supracapsular phaco. But you will find shining cornea on the first post-op day in vertical chop in the bag technique. You can see only posterior cortex has remained. Now here you should be very vigilant, and you should not if you don't have greater control of the phaco, you should not remove those posterior sheets with phacoemulsification. Like we have removed the cortical sheets inferiorly, but for superior cortical sheets I'll remove those with Simcoe cannula. And now we have almost we have removed all the cortical sheets. You can see And now I would like to implant the foldable intraocular lens. One haptic is again above the anterior capsule. So with the help of a dialer, I'll push the IOL into the bag. Now it is in the bag, and now we will remove all the viscoelastic, and if some cortical sheets are remaining, we should remove those. So in this video I have shown you vertical chop in the bag phacoemulsification technique. I hope you have liked it. You can post your queries in the comments. Thank you.